So, hello everybody. My name is Tamara Milagre. I'm the president of EVITA, Portuguese patient association that supports families affected by hereditary cancer. And I really would love to talk to you today about a specific topic that is very close to my heart, which is hereditary breast cancer, because in fact, I'm a BRCA1 carrier myself. And I have the paternal mutation, which I only learned about when I had a 27-year-old pregnant lady in my hospital. I was working as a nurse then in the gynecology hospital in Lisbon, and she had a mastectomy, still pregnant at 27 years old, in the 29th week of pregnancy in our hospital. And I took care of her in our recovery room, and I was listening to the unborn baby's heartbeat. And I was looking at her and I was asking myself, what happened here? I mean, she's 27. I never saw this. She's now here operated, mutilated. I knew from the report that the lymph nodes were already affected. And I was really shocked. So I followed up her doctor appointments. I learned about her family history of breast cancer on the paternal side. Two aunts had died in their 40s of breast cancer. And then her thankfully, literature doctor at the time, it was back in 2007, she proposed a BRCA test for this patient, and the result came back positive. That was the point where I said, okay, I have myself a very, very complex family history of cancer. I lost paternal aunts and grandmother as well as my father to hereditary cancer. And I spoke to our geneticist, and she said, you are mother of two daughters. Your family history is really strong. And additionally, I had my mother with breast cancer at 44. So we did genetic testing. It came back positive 3 months later. And that was the point where I learned I have this genetic predisposition. I have a very high risk to develop breast and or ovarian cancer. And I have to do something about it. So I myself decided to advance with the risk-reducing surgeries. I had a double preventive mastectomy, and I had a total hysterectomy. That was a personalized decision on my part because it only needs to get out the ovaries if you have a BRCA1 mutation. But for my personal health condition, I decided to have the total hysterectomy. So ovaries, tubes, of course, and the womb, the endometrium. So, as we all know, this is no news. Breast cancer is the most frequent type of cancer in women worldwide. Anyways, 1 in 100 breast cancers is a man. And so a BRCA2 male carrier has 100-fold higher chance to develop male breast cancer. So men, be aware, you can get breast cancer too. So as literature says, 10% of all cancers are hereditary cancers. So it's not the cancer we inherit, by the way, it's a genetic predisposition. So at the time of the conception, we inherit of both of our parents a gene copy. And if one of our parents is affected by a genetic pathogenic variant that gives us high risk for cancer, and by coincidence, by a chance of 50% or less, this genetic predisposition may pass down with the faulty genes to the embryo, then this child will be a carrier as well. But if you look at the Portuguese scenario, for example, we have the latest numbers are already at least 3 or 4 years old. We are expecting new numbers at the end of this year, but the latest numbers available point for 9,000 breast cancer diagnoses each year in Portugal. So if we do the math, we have really quickly we come to the conclusion that 900 of those hereditary breast cancers, so 10% of the 9,900 breast cancers we diagnose in young women every year, that could be prevented. So at Evita, we defend cancer prevention. And I mean, the prevention of disease and waste is the fundamental pillar for sustainability in a healthcare system. So we need to look more after prevention, not to talk about the disease burden that hits the cancer patient as well as the whole family, because this hereditary cancer topic is a family issue. It's not an individual disease. So at the same time as we have 10% hereditary cancer overall, which is a lot because we have a lot of cancer each year, diagnosis, sorry. So only 20% of these variant carriers are actually identified. That means 80% have no clue that they have this genetic predisposition. So that's dangerous because they are not entering personalized risk stratification with vigilance and prevention, because they don't know about their predisposition. And the main reason for this lacking identification, in our view, is a lack of genetic literacy, even in healthcare professionals. Remember my own story back in 2007, way before Angelina Jolie talked about her mutation. The world didn't talk about hereditary cancer. It was unknown, an unspoken subject. So even me, healthcare professionals, back in 2007, I had no idea that there exists something like hereditary cancer. No idea. I was wondering, in fact, why everybody in our family got cancer all the time, but I had no idea that this could be an inherited condition. So the other thing is, more than half of hereditary breast cancer patients do not meet actual testing criteria for genetic testing. So the family history alone is not enough to identify genetic variant carriers. So what is suspicious, for example, in the case of breast cancer, if we have a diagnosis at a younger age, before 50 years, before menopause, a diagnosis with breast cancer. If we have a bilateral diagnosis, both breasts are affected at the time we are diagnosed. Certain subtypes like triple negative breast cancer is already nowadays an indication for genetic testing. Also, a case of male breast cancer in the family is a clear reason for genetic testing, and multiple cases along the generations, when the whole paternal side had always at young age some kind of interdependent cancer cases, because one gene that is not working well affects a group of organs. We are talking about breast cancer in young women here today, but know that, for example, a BRCA mutation, which is the BRCA2 mutation, for example, which is our famous Portuguese founder mutation. It's a mutation that is very much present in Portugal. It's responsible for 30% of all BRCA-related breast cancers and even 60% of all BRCA2-related breast cancers. And this gene, BRCA2, can give you breast cancer in women and in men, ovarian cancer, prostate cancer, and we have also a lightly increased risk for pancreatic cancer. So the Portuguese population specifically is also a European champion in emigration. We have 20% of the population emigrated outside Portugal, and we have had contact from women from France that had a very strong and very typical BRCA family and personal history of cancer, but their test result came back negative. So we asked them to make sure with their doctor that the Portuguese founder mutation was found, because this mutation is specific. It needs a very specific sequencing method, and you only find it if you look it up proactively. So everybody outside Portugal taking care of people with Portuguese ancestry and having the question of a hereditary cancer syndrome, look up the Portuguese founder mutation. It's worth it. It's very much present in the Portuguese population. So our proposal at Evita is, why don't we screen all women with Portuguese ancestry from 24 years on? Like, yeah, you know, naturally they go to their doctor, they get their blood tested for this founder mutation. We even could send a self-help kit to their home where they collect their own sample of saliva and send it in or leave it with their family doctor. We could find this way also women with no evident personal or family history of cancer, but they are still carriers. And once we identify this woman in a family, we can identify the whole family and all carriers in this family, and they can enter immediately a personalized surveillance, because the surveillance in BRCA carriers starts at 25 years. I'm talking about women. So BRCA carrier, women, female BRCA carrier, they need to get checked their breast at 424, starting with ultrasound. Of course, they need to know very well their breast tissue so they detect if there are any changes, and so on and so forth. So hereditary cancer is preventable, at least early detectable, but we can prevent it, in fact, if we advance with preventable risk-reducing surgeries, which is in case of BRCA, would be a bilateral preventive mastectomy, and it would be a preventive bilateral ovarectomy, also tubes out. So the last point is, you can also, as a carrier, decide to undergo fertilization in vitro and select the embryo in 3 days in lab. You just take out one of the 8 cells and you understand which are the embryos with the mutation, and you can reimplant the embryos that are free of the mutation, and that means just the end of the mutation in your family strength. So these are options. That is why it's so important and very good to understand why it's so important to know if we have a genetic predisposition. And on our side of Evita, during the last 6 years, we built a digital platform based on the identified real needs of genetic variant carriers. And the heart piece of Evita platform is a 10-question risk awareness questionnaire that helps you while you are filling it in to understand more about signs of a potential hereditary cancer syndrome in your family. And you get also an immediate test result that gives you advice regarding the necessity to have genetic counseling with a genetic counselor, medical geneticist, whoever is the professional educated and educated to give you the genetic counseling. So you get a professional evaluation if you would need genetic testing. And then you are in the system, and then you can initiate your personalized surveillance, and you can also think about risk-reducing surgeries. Again, I'm a BRCA1 carrier. I'm here. I'm alive. The only reason I'm alive today talking to you is because I knew about the genetic variant before I could be surprised with small daughters at home by aggressive breast cancer at young age or even ovarian cancer. So it's a good thing to know when we have this predisposition. It's a very important tool when we are healthcare professionals that are taking care of these kind of patients that may have genetic predisposition. And if you scan this QR code I show you here in the slide, you can access our Evita platform. You can fill the questionnaire in with your patient by your side, for example, and it helps you to understand and decide if there would be a benefit for this patient to undergo genetic counseling with a specialist. And with that, I thank you very much for your attention. I wish you a great discussion, a great conference. I'm so sorry I couldn't be there. Maybe next time. Thank you so much for having me. Bye.